Welcome to a TRE session, getting into it on my bed and instantly having some diaphragm tremors, some in the back. And lately I've been experiencing a lot in the diaphragm and a lot of side-to-side movements with the neck and upper traps. And you might find that certain movements feel better than others and happen consistently for you. For me, that's the side-to-side movements happening right now with my neck, which is originating from the upper traps, it seems like. And it releases a lot of tension in my face and behind the eyes, so there's a way in which we can see that things are connected, since as my upper traps tremor and tension is released from them, then tension in the back of the head releases a bit, and in the face and the muscles around the eyes. So the face is quite complex, interconnects with the skull, muscles in the back, and those are connected with the neck and trapped muscles, which insert in the back of the skull. And here I'm also making some faces, and the mouth is opening a lot, because those are also connected. You see some rapid tremoring. The video is sped up somewhat, but there's tiny and rapid tremors happening in the front, the diaphragm, and also in the back. And these breath holds will happen for me. You might find they happen for you too. I have had more of a connection to my breath from TRE than any breath work I've ever done, because the breath work is more forced in my experience, and the TRE is resulting naturally from the body. And I've learned a lot about my breath and my respiration and my diaphragm and rib cage through TRE, and my breathing has improved a lot. My breathing has even improved despite a deviated septum, which caused me a lot of really big challenges breathing the past couple of years. And that's one of the little miracles of TRE that people often experience. For me, mine was improved breathing. So in my first 6 months of TRE, my legs and hips were always tremoring. Even if my upper body was tremoring, my legs and hips were tremoring along with them. And about a month ago, the upper body started tremoring and the lower body wouldn't tremor. I mean, it would tremor, but I would have times where it wasn't tremoring, which was new. But they tend to tremor together, and now I have a lot of action in the neck and upper traps. You can see, like I was talking about, it feels really wonderful for me. It also, however, teaches me surrender, because, and you might experience this with neck movements in TRE, that there's kind of some danger or some risk if we're resisting rapid, vigorous neck movements at all. Because the neck is a sensitive area, if it's moving vigorously, it's important to really let go. And not collapse, but rather surrender. Here there's some wonderful natural movement happening, coordinated with the hips, the rib cage, and the neck, ending with a big yawn. Big, long yawn. And a little calmness here. like a calm after a storm until the next wave of tremors comes through. And you can really see in some of these movements that rather than tremoring as in shaking, tremoring in the form of unwinding motions, undulating, gyrating motions are occurring a lot in this video with me. And that's a natural result of having tremored through a lot of the most developed blockages. Now this is an example of some vigorous neck movement. And you can see the importance of surrender here, because this could lead to minor injury if I'm resisting it at all. You also notice that my legs are straight. And that's something I've started doing the past couple weeks. Normally when the legs are straight, it ends the tremors or encourages them to relax and end. However, for me, and specifically because most of my tremoring is happening in the upper body these days, I still tremor just the same in my upper body, my spine, my hips, when my legs are long. And I tremor a little bit differently, and it's welcome, because it's new. So here in a down-regulated state, awaiting the next wave of tremors if it decides to come. And I very much value these quiet periods in my practice because we are learning how to really relax. Here having some tremors in the internal rotator cuff, pulling the shoulders forward. And perhaps the greatest gift of TRE is the ability to reach new depths in the nervous system state. In addition to that, we would have these little miracles like greatly reduced back pain or improved breathing or reduced jaw tension. Here I turn the camera off and continue to integrate. Wishing you really well, and see you all next time.